Office as a leader for the transformation digital in Indonesia, especially in the health sector, is ongoing process to integrate it. With one health data policy that now focus on individual data, which is collected from existing reporting system, especially to meet data needs in decision making and the management level, Digital Transformation Office has built Indonesian Health Services as a platform with the One Health Data principle, cover standardization, interoperability, and accountability. Therefore, interoperability and data integration between systems is important and definitely requires a lot of resources. Ladies and gentlemen, with the support from several partners, Indonesia Ministry of Health is starting to use the artificial intelligence and the big data management approach to facilitate and accelerate the decision making in the health sector. In order to communicate the digital transformation of Ministry of Health in general, and as a follow-up the result of research dive for COVID-19 data analytic partnership that conducted Ministry of Health with the Jakarta Pulse Lab, Pusdatin Renbang, and Directorate of Health of the Ministry of Planning or Bappenas. Today we hold webinar on the topic of best practice and responsibility harnessing data in times of public health crisis as the continuation of the development partners meeting before and also as a means to share knowledge and experience. That are what I can say. I hope that this webinar we have a new ideas, innovation that can become an input for our Ministry of Health, and also the Ministry of Planning and other government side, and be beneficial for health development and realizing a healthy Indonesia. Wassalamualaikum warahmatullahi wabarakatuh. Thank you.
Thank you so much, Pak Rudi. It's also great to hear development here in the Digital Transformation Office at the Ministry of Health and then the Center Data for Information. Thank you again. Now, I would like to welcome Pak Irfan Saleh, the Head of Center for Data Information for the Development Planning, Indonesian Ministry of National Development Planning, to deliver welcoming remarks. Pak Irfan, the screen is yours.
Terima kasih, Bu Desi. Assalamualaikum warahmatullahi wabarakatuh. Selamat pagi. Good morning, everybody, ladies and gentlemen. Pak Rudi from Pusdatin Ministry of Health, Pak Petra from Lab Jakarta, our honorable speakers and all attendees in this webinar. It's our pleasure to welcome you to this webinar on the best practice in responsibly harnessing data in times of public health crisis during our experiences in COVID-19 pandemic situation. This event is part of our joint collaborations, Ministry of Health, Ministry of Development Planning, Bappenas, and Lab Jakarta. And we invite some speakers from other regions in the globe to listen our experience together, and today we hopefully can have a lot of experiences and knowledge about our past 2 years experiences. The COVID pandemic seems to be far from over, but thankfully now we have a very low experience of the peak of the pandemic, but reflecting of the all the opportunities and challenges that we face in this era, we are now become more aware about the importance of data and innovation to respond to the public health crisis. And that's one of our main experiences in these past 2 years. We have seen that researchers and analysts around the world have produced different reports and findings that can provide lessons for improving policy responses to the COVID-19 crisis, including what we are experiencing in Indonesia, as Pak Rudi mentioned, and maybe Bu Dewi will explain further. Our analytic partnership with the Ministry of Health and Pulse Lab Jakarta especially highlighted the importance of high quality and integrated data system integration to ensure the timely evidence-based decision-making in healthcare and for our leaders to make decisions during the pandemic. And I believe that by participating this webinar, we are in the right place and right time to accelerate and exchange of ideas and scaling up our good practices in responsibly harnessing data in times of public health crisis. And lastly, I thank all the speakers for joining us here. Pak Vincent Lemniale from Cairo, Ibu Lydia Romanov, and Pak Kasum Amarasing and Ibu Dewi for your time to share all your experiences in this topic. And I hope all participants and attendees here have an active participation during our discussions. And hopefully we will have a fruitful discussions. Thank you very much. And give back to Ibu Desi.
Thank you very much, Pak Irfan. Esteemed guests, without further ado, we'll now turn to Sri Ganesh, Lab Jakarta Data Innovation and Policy Lead, who will be moderating today's panel discussion. Over to you, Sri Ganesh.
Thank you, Desi, and welcome everyone. We are extremely privileged to have a distinguished lineup of speakers here today. Just before we sort of go into the presentations, just wanted to remind everyone that to please put in your questions in the Q&A box that is available here, and ideally also mark who you may want to answer that question. Secondly, the basic format of how we'll be doing today is we will have 4 presentations of 15 minutes each, one after the other, followed by 30 minutes of moderated panel discussion as well as general Q&A. So we welcome people to put in their questions even earlier, and we'll take them up depending on time. We may not be able to cover all the questions, but hope to cover as much as possible. So without further ado, let me just briefly introduce our 4 distinguished speakers. We have first Dr. Kasum Amarasinghe from Carnegie Mellon University, who works across the Machine Learning Department and the Heinz School of Public Policy. Kasum's work extends into the study of the development of human AI collaborative systems for both governments and nonprofits, looking at both the ethical and equity concerns of such concerns, as well as improving transparency of complex AI machine learning-based decision support systems. His group has worked extensively with the public sector in the United States, as well as from around the globe. He has a PhD from Virginia Commonwealth University. He will be talking a little bit about how to sort of approach data innovation in the public sector. We'll be followed by Dr. Vincent Lemniale, who's a team leader and senior research scientist at the Commonwealth Scientific and Industrial Research Organization, CSIRO, of Australia, where he conducts research on the application of computational models to natural hazards in complex systems. He will be talking a little bit about agent-based models, including a piece of software library called Pixie, which has also been applied in the Indonesian context. The third speaker, Ms. Mila Romanov, is a lawyer by training and is the data policy and governance lead at UN Global Pulse based in New York. She works on issues related to AI and data governance and ethics in emerging data technology, as well as the regulations. She has worked extensively on these issues, both within the UN as well as informed relevant regulations and policies around the world. and is also been involved in the UN's data strategy as well as the UN's privacy policy. Finally, last but not least, we will have Ibu Devi, Dr. Ibu Devi Nur Aisha, who is the head of primary care tribe at the Digital Transformation Office of the Ministry of Health, who has worked extensively in the public health sector in various roles. He's an epidemiologist by training with a PhD from UCL, University College London, and a master's from Imperial College, also from the UK. So without further ado, I'd like to move into the first presentation. Dr. Kassan, if you may kindly share your screen. Just wanted to remind you, you have 15 minutes. Thank you.
Awesome. Give me 1 second to get my screen shared. I hope y'all can see my screen. Thank you, Sri Ganesh, for that introduction. And thank you for having us. And these type of events are really important in building partnerships between government organizations and organizations such as the UN Global Pulse, where you have the technical know-how and the data science capabilities so that we can harness them in times of need. Today, I thought of talking about how to approach such partnerships between, very crudely put, data people and policy people, and how do we effectively bring these people together in doing something that's impactful while being responsible, while being ethical, while thinking through the risks of doing data-driven decision making and using data science. A quick note about the people that I work with at CMU. I belong to a research lab called Data Science and Public Policy, which is headed by Professor Raid Ghani, who has been in the space of using data science for governments and nonprofits for a long time now. And we kind of uniquely sit, as Sri Ganesh mentioned, in the middle of the machine learning department and Heinz School of Public Policy. So you're kind of uniquely positioned to use machine learning for very cool things. So we study how to use these fancy algorithms that you usually use to sell us advertisements on the internet, usually, and get us to watch more YouTube and stay on Facebook, to see whether we can use those algorithms to actually do some good. Can we help nonprofits make important decisions based on data? Can we help government organizations use the limited resources that they have to get the maximum output from those resources? So we've had the opportunity of working across a bunch of organizations, mainly in the US, but outside of the US as well. So I thought of sharing a few lessons that we've learned along the way with these partnerships, and talking about how we can set up these partnerships effectively. So as I mentioned, let's talk about how we approach the partnership between the policy people and the data people. How do we scope a project effectively? How do we make sure that what we build is useful and effective? Because we tend to get sidelined. When I say we, the data people, tend to get sidelined by cool things and shiny things. We need the policy people who are working on the ground to actually put us, tether us to the ground and make sure that we build something useful rather than something cool. So let's start with the partnership piece. This is something that gets often overlooked in data innovation, data science, machine learning, AI, big data, whatever buzzword that we want to use. And we kind of diminish the role of the policymaker and the government partner in that process. It is very important to have both parties working together, not just at the beginning, but for the entire duration. We tend to approach partnerships. Something that we come across a lot is that government organizations, such as the Ministry of Health in Indonesia and the folks that are joining this webinar today, think that data innovation is partnering up with some organization that has the technical know-how, such as our research group, giving them some data, and the technical people will go away, do some magic, come back, and you deploy that. It's not as simple as that. So it's not just throwing data over the fence. You have two types of people. The AI developers or the data people like ourselves know how to evaluate data systems. We know how to match operational requirements into analytical goals. We know how to understand how to create systems with the data that's available. However, while those skill sets are useful, the policymaker and the people on the ground are critical. They are the ones who understand the actual goals that you're trying to achieve, the actual problem that you're trying to solve. Who's going to be impacted by solving this problem? Who's going to be using this system? What are the operational requirements? Maybe you only can help 100 households, 100 people, 100 geographic locations. Those constraints, because those constraints matter when you actually evaluate a system that you build. Knows the key stakeholders, who owns the data, who would be approving the system that someone builds. All of these things need to be clearly identified, and this complementary sets of knowledge is very important to come together for us to create a very successful project. Once we mention this, a lot of people go, yeah, of course, like how else would you do it? But you'd be surprised to see how often this part of the process gets diminished by the fancy algorithm that does computer vision or some attractive thing that takes all the attention away from these kind of details. And the other thing that often gets sidelined is using the appropriate set of stakeholders for the project. One example, one lesson that we learned last year was, this is not necessarily from public health, but I think it's very pertinent to the domain as well. We had a partnership with the American Civil Liberties Union, or the ACLU. We spoke with their data analysis team, and we built this tool to prioritize, identify bills that would be important to the ACLU. So predict when a bill is introduced to the legislature, can we actually predict the likelihood of that being important to the legislature, to the ACLU, sorry. We built this system. We predicted how likely the bill is about to pass, and what topic areas are included in the bill, and so on and so forth. We built this fancy system, but we failed to identify people who would actually use that system. So once we built the system and spoke to them who would be eventually using it, they said, no, we don't trust a system to tell us when a bill is going to pass. We want to make that determination ourselves. So had they been in the conversation from the start, we would have realized that, and we would have saved a lot of time. So while we think these things are a given, it is very important to think this through at the beginning to identify important stakeholders. So that's approaching the partnership side. Another thing that is very important to build that partnership along the way is something called project scoping. This is something, again, that falls apart in a lot of the systems that we've seen. Badly scoped projects tend to have outputs that are not really used and not really impactful. So before writing a single line of code, I know data people like us, right? We all love data. We want to go and build something and have cool figures and cool visualizations. But before we do that, we have to restrain ourselves and figure out a couple of things. Number one, determine the goals. We always should start with the goals. If you don't remember anything from my presentation, one thing, if you want to take away one thing, it's this: never ever start with the data. Yes, this is data innovation, this is data science, but do not start with the data. Because when we start with the data and lose sight of the problem, we tend to build things that are cool, again, not useful and not solving the problem. So we should always start with the goal that stems from a problem that an organization already has. So what's a well-defined goal? One, the goal should be achievable, specific, and measurable. What do this mean? A well-defined goal should be actually feasible, right? So we tend to start with abstract goals. So an abstract goal for a public health system is to improve health outcomes for a certain of people in Indonesia. That's a very abstract goal, right? What does that mean? What does it mean to improve health outcomes? And you have to drill down to identify something that is very specific. And why does it need to be measurable? If you can't measure it, you can't improve it, right? So whatever system that we build, we need to make sure that it's actually helping us achieve a goal. So if we can't actually quantify it and measure it, then it's difficult to see whether we are achieving the goal that we set out to meet. And the other thing is we have to consider constraints, operational, both operational and ethical. So operational constraints are sometimes you have this goal of impacting legislation, but you might have limited buy-in with the legislatures. There might be limited organizational buy-in. There might be resource constraints where it prevents you from helping more than 10 households. It's a very real thing in the government sector. So for instance, in the COVID-19 pandemic, if you wanted to deploy mobile vaccination sites or testing sites, there were only so many vaccination mobile vans or trucks or whatever that you could deploy. So you needed to identify, so that's the constraint. So how do we identify the best 10 places where we could send that vaccination clinic to? What's the most useful one? And the ethical concern there is maybe it's more effective to send it to a location where we have a lot of data about, and we are very confident that this would be effective. Maybe there are gaps in data about a certain demographic in the US that tends to happen with communities that have very informal employment, very informal settings, which tends to correlate with vulnerable demographics, traditionally vulnerable demographics in the US. So we need to really think through these limitations and constraints when we actually set out our goals.
Kasan, sorry, you have about 3-4 minutes left. Just to let you know the time.
Okay, thank
you.
Yeah. So, and the other thing is, I'm going to spend time on this because it's the thing that I want to drill in. The goal is not to build a model. The goal is to solve a problem, which is very important. And this is the most critical step of the scoping process. Identifying actions. This is very important as well, because what would you do differently with the system that you build, with the innovation that you do, with the data that you collect and the data science system that you build? Is that action within your control? If it's not, if you don't know what you would do differently, if you don't know what actions this would inform, if the actions that you identify are not within your control, either you have to bring in the people who have the actions under their control into the project, or figure out what actions that you actually would inform. If you shrug your shoulders to these questions, you probably shouldn't move on with this project. You actually should think these through, because the chances are you'll be wasting your time. And then you go to the data. Only then you go to the data. Identify who owns the data, what data sources that you have access to. Can the data be shared with the developers? Maybe you need to de-identify their personal identifiers. How often does the data get updated? What format the data is in? All those things need to come into play. Sometimes it's in PDF files where it's very difficult for machines to read it. So these are questions that you need to answer about the data. Once we have all of this figured out, you can actually move on and to the analytical stuff. So there are different types of analysis that we can do. I'll quickly run through a few examples. We've built predictive models where we predict a future outcome. Something like we have this project where we identified patients who are likely to drop out of long-term care, so that we could make sure we can proactively intervene with them and help give them the additional services they need so that they would not drop out of long-term care. Identify kids who are likely to miss vaccination appointments. This is a project that we did last year with Mexico City Carlos Slim Foundation. Then do proactive outreach to them, maybe even send out mobile vaccination clinics to their vicinity to get the kids vaccinated. Detecting current patterns, like this is very common, something that we see, heart disease from echocardiogram images, like identify different biomarkers from images. Describing past events, which is something that we use with clustering mostly, is to identify patterns that occur in the past, but this is typically not the only portion of a project. And there are other different analysis that we can do. Irrespective of what analysis you do, make sure that we have to inform the identified actions, and we have to make sure that the data that we have available is sufficient to obtain reliable results. If it's not, we need to either downscope, or we have to go and see what other data that we can collect. What data do we need, and what data do we have? Then again, important point, if an analysis is not informing an action, think it through, because then the analysis that you do will not be used. If there's a pretty dashboard that's nice to look at but not useful, probably that time should have been spent on something else. So this process is very iterative. So
sorry, Kasim, could you wrap up if possible, about 30 seconds, if that's possible?
I will stop from here. We can discuss the ethics part, I guess, in the
yeah, we can talk about the ethics part afterwards. Thank you.
Yeah. So this process is very this process is very iterative. So things get refined as you go, but goals, actions, data, and only then analysis in that order would be a great way to approach a data science system for the public sector, and make sure to have both parties, data people and the policy people, working together throughout the entire project. Thanks.
Thank you, Kasim. Thank you for reinforcing the thought that it is not just about the data and the fancy algorithm, but it's very much people are involved, and the importance of doing proper scoping in order to have successful data innovation projects. Without further ado, I want to sort of move on to our next speaker, Dr. Vincent from CSIRO, who'll be talking a little bit about agent-based models. Dr. Vincent, the floor is yours. 15 minutes max. Thank you.
Okay, thank you. Let me just share my screen. So am I sharing my screen?
Yes, it's coming across. Go ahead.
Okay, excellent. All right, thanks very much, and thanks for the invitation for talking today. I really appreciate it. So I'm Vincent Lemial. I'm from the CSIRO, which is Australia's National Science Agency. And the work I belong to is the Natural Systems Modeling Group. And we specialize in modeling natural systems, such as things like floods, fires, using physics-based modeling, as well as things like evacuation modeling and the spread of diseases using agent-based models. And today, I will focus on agent-based models specifically in my talk, and on how they were used to help manage COVID-19 and drive the response of various governments around the world. So in many ways, my talk is actually an application of some of the principles that were discussed in the previous talk with Kasim's presentation. So before I go into, so I'll do that through three examples around the world. But before I go into those case studies, let me give you a brief overview of what is an agent-based model, for those who may not know the approach. And conceptually, it's actually very simple. So the idea is the idea of an agent-based model is to simulate a system through the actions and interactions of its components. So if you want to look at the spread of a virus in a population, so the system is the population, and its components are individuals, which are called agents in the simulation. And each agent is simulated in the model, has characteristics, and does things during the simulation, go to work, go home, does various kinds of activities. And agents interact with each other. And when an infectious agent, which is represented in red in this diagram, comes into contact with other agents, there's a likelihood that it might infect them. And in this way, you can like the spread of the virus in the population. So conceptually, it's very simple. It's very much trying to reproduce reality. The modeling.
Sorry, we seem to have lost Dr. Vincent for a minute. Do you know if they see if he's back online or if he's sort of gotten logged out?
Always.
Okay. All right. Vincent, can you hear us? Sorry, we seem to have lost Dr. Vincent there. He's back online, coming on. We'll just give him a minute.
Can you hear me?
Yes, we can, Vincent. Maybe you can, if there's a bandwidth issue, maybe you can switch off your video and you can go back.
Hey, I'm sorry, I'm not sure what happened. Okay, let me switch off my video then. So, sorry, where did you lose me? So I'll repeat myself.
You were talking about, the how agent-based models work, and that, basically these are modeled as a system with, certain levels of data needs. Just
okay,
over there.
okay.
Right?
Yeah, okay. Sorry about that. So let me switch off my video. Yes, so building the model, as I was saying, can be very challenging because of the data requirements. And in fact,
can you share your screen again as well? I think we've lost the presentation.
Sorry about that. Is that working?
Yeah, go ahead.
Apologies. Yeah, so in fact, Professor Ferguson from Imperial College London said in 2005 of his study of the H5N1 avian flu in Thailand that actually collecting the data on Thailand's population was harder than coding the model itself. So that leads me to the case studies that I want to discuss today briefly. And the first one, I'm coming back to Professor Ferguson and his team at Imperial College London, is the case of the UK and how the ABMs have driven the government response early in the pandemic. So Professor Ferguson and his team adapted the agent-based model, the one I just mentioned for the avian flu in Thailand. So they adapted the ABM to try to forecast what would happen early in the pandemic if no action was taken. And they also carried out scenario analysis to assess the potential of mitigation strategies and the options that were available to the government. And interestingly, it's interesting to know that it was early in the pandemic. So the report was released in March 2020. So very little was known about the virus at the time. There was very little data available. Nevertheless, doing a scenario analysis where you conduct what-if scenarios was useful, qualitatively speaking, to understand the potential effect of different scenarios. and essentially to understand the risk of doing nothing and the likelihood of a certain outcome happening depending on what the government would do. And this report had a very large impact, and the UK government essentially followed their recommendations and implemented restrictions shortly afterwards. And other governments around the world did the same, the US, some countries in Europe. So ABMs were very much used to drive the government's response early in the pandemic. The second case study that I wanted to discuss was in Australia, so in Melbourne where I live, so I'm very familiar with this case. Some of you may know that Melbourne is, so we went through 6 lockdowns for a total of 260 days. And that was a world record at the end of 2021. I don't know if it still holds, but it was at the end of 2021. And one of the reasons so the government went very hard, and there was strict lockdowns. And one of the reasons that the government pursued a very aggressive suppression strategy was because it could afford it. Essentially because of the unique situation of Australia. It's an very large isolated island with pockets of populated cities, but not much in between. And so in many ways, it's easier to sort of track what's going on in such an environment compared to other countries in the world. And so for a very long time, the Victorian government tried to pursue a very aggressive suppression strategy where they tried to essentially reach a zero community transmission. And this was very much driven by ABM predictions. So a combination of data collection and ABM predictions. And again, because we had very few cases, we could afford to track down to individual cases and doing very detailed, very specific contact tracing. And so we had extremely accurate data, which allowed us to understand how the virus was moving in the population. And this was very helpful in informing the government of what decisions to make. So this work was actually done by the Burnet Institute, which is a medical research center in Melbourne, and they were commissioned by the Victorian government to provide advice through the modeling platform COVASIM. And so every step of the way through the pandemic, the government used ABMs. And I'm showing the report by the Burnet Institute here on the modeling the Victorian roadmap out of the pandemic, so at the end of 2021. So it was also used to understand how to gradually reopen the economy without risking a resurgence of cases. So other groups did simulations as well, including us at CSR. We used a software called Pixie, and I'm showing here a simulation which was pretty much consistent with the COVASIM model. This is showing that if the lockdown was shortened, so was too short, essentially as soon as the restrictions were lifted, then you would have seen a sharp rise in infections. So obviously that was to be avoided, and that was indeed avoided by the long lockdowns we went through. So I think it wasn't for nothing, which is a good thing. Okay, so moving on to Indonesia, what we did is we decided to use Pixie. So that's a work in collaboration with a number of Indonesian partners that I've listed at the bottom of this slide. We use Pixie to build a model for the city of Bekasi and to try to address some policy questions. So there was also another stream of work in Jakarta, but I won't have time to discuss it today. I'm going to focus on the Pixie work given the time constraints. So essentially the idea was to try to use the model to see if we could help address some of the questions that were being put forward around where the infections were taking place, and so consequently which locations should be closed and for how long, as well as, so this work was done about a year ago, April, May last year. And so at the time, the question was around whether or not it would be safe to reopen schools, either partially or fully. And so we decided to adopt a two-step modeling strategy, where first we build what we call the retrospective model, which is essentially calibrating the model against historical data, so from prior periods during the pandemic, and see if we could reproduce the observed rate of spread. And once the model was calibrated, then we could use it in a predictive manner to carry out scenario analysis. So very much similar to what was done in other countries. And so one of the challenges that we faced, even at the calibration step, was actually insufficient and not reliable data. And so what happened was essentially the model was predicting a higher number of infections than observed in real life. And it turns out that this was due to the fact that the number of reported cases was underestimated for a couple of reasons. One was not enough tests were conducted, and so positive cases were missed. And also there's a number of people who were actually asymptomatic and therefore were not being tested. And they would go unnoticed as positive cases, whereas in the simulations, those would be simulated. So we had to accept the fact that the model, there's no point in calibrating the model to try to match data if the data is unreliable. So we have to accept the fact that it is in fact expected that the model will in a way not over predict, but will predict higher number of infections than in real life. Having said that, you can still use the model in a qualitative manner because, and that's something I haven't mentioned before, but the reason why you would use ABM in the first place is because you can draw a very detailed picture of what's going on. And so you can go very deep in the analysis down to the individual level or distribution as compared to simpler approaches such as equation-based models, which tend to aggregate the data, and so you don't get that level of granularity in the outputs. And so what the model showed in a qualitative manner was that the dominant places of infections were in the workplace, which is actually consistent with what was observed. The reason being most of the workers were not following the instructions to work from home from various reasons. So the number that we used in the model was that 5% of former workers were actually working from home. And that is reflected in the transmission taking place in workplaces. So from a policy implication perspective, that means that the adequate measures should target the most dominant places of infection. So that's one way of driving the policymakers' decisions. In that they can target the most dominant factors first. So on the issue of potentially reopening schools, what we saw is we tried different scenarios, reopening partially 50% and fully all schools. And what we saw was that it actually doesn't lead to a very large number of new infections at schools compared to the infections in other places such as home and work. And the reason is simply because the main problem is in the workplace to begin with. And so therefore, from a policy implication perspective, again, reopening schools, that doesn't mean that it's safe to reopen schools. It means it has to be done in conjunction with handling other problems, as I said, such as workplace issues. Of course, the model doesn't say anything about other considerations, such as the issue of remote learning and the mental health issues that can lead, that can result from that, the economic impact for parents needing to care for their parents at home. So I guess what I mean by that is that ABMs are useful. They're just a tool among others, and they're not a substitute for the decision-making process. They're not replacing the decision-making process, but instead they should be used. Modelers should work hand in hand with decision makers. So I think I'm probably at time, I'm guessing, especially with the earlier glitch. So this is my last slide. So I guess I hope I showed you through those case studies how ABMs can be used in real life to help decision makers make more informed, data-driven decisions. So I've used COVID-19 as an example, of course, but that can be they can be used for other health crises in general, and in fact they're also applicable to a wide range of applications to better understand people's movements, social interactions, and build safer environment. And as I said, it's not a replacement for decision making; it's a tool among others. That's important to remember. And I think there's a couple of areas where, and again, I hope I've shown that in the examples, where you have good data, you can start using the model in almost in a real-time way, where the model consumes the data that is being collected, and that improves the forecast. And I think that's one area where improvements have to be made in some places. And the last point is something that hasn't been tackled yet to a large extent, which is the psychology of humans. As we know, humans are humans, and they don't necessarily do what we think they will do, especially when it comes to following orders and when restrictions are in place. And so I really believe that human behavior will be at the heart of future models. And that's a whole new area in itself. How do you collect data to understand the psychology of human beings? That's a very fascinating area, and it's only just the beginning. So with that, I might end, and I thank you for your attention. I'm sorry about the glitch.
Thank you, Vincent, for talking us through sort of agent-based models and its utility, especially in the case of COVID-19. There's sort of a lot of interesting questions that come up. We'll take that up a little bit in the question and answer session. But without further ado, to move on to our next speaker, Ms. Mila Romanov from UN Global Pulse. Vincent, could you stop sharing your screen so that Mila can load up hers? Thank you. Mila, over to you, and look forward to us now hearing from you about, while all these innovations are great, how do we ensure that this is done sort of in a responsible fashion, and hope you can speak to that. Thank you. Over to you, Mila, 15 minutes.
Thank you. And Sri Ganesh, I would definitely appreciate a notification when the 15 minutes are almost up.
I will message you on and I'll come. Yeah. Okay. Go ahead.
Thank you. First of all, I would like to thank you so much to the organizers and for inviting me to speak today. I will briefly about my background with Global Pulse. I've been leading the data protection and data governance work, overall data policy work for the United Nations Global Pulse, and working specifically in close cooperation with the technical team, especially the research and development team, actually taught me a lot on what we need to do to ensure that that not only that we think about data protection, privacy, data governance, and ethics, but we actually ensure that we get the value out of data in a responsible way, and we build trust by with the users of this data and the individuals whose data is being used to extract value out of it for their benefit, and that's in a way the goal and the objective of our work, right? When we talk about using data in any type of a social good scenario, including health, and COVID-19 particularly showed us a lot of opportunities and venues of how data could be useful in tackling the ongoing pandemic. Just with the mobile data alone, the MNO's data, and following the recent report by the GSM Association on how data could be used to respond to the ongoing crisis of COVID-19 through population mapping, through population mobility, producing epidemiological modeling, logistics and infrastructure monitoring, economic modeling to provide insights on how the communities are recovering or reacting to the COVID-19 response and the ongoing restrictions. And when we talk about not just mobile data, but when we talk about social media data, that has also been increasingly used to understand, for example, response to COVID-19. or radio mining data that we've been using in regions, including in Africa, where the internet penetration is not as high, and when we cannot rely on social media data. Radio data and mobile data were actually the resources that could help us understand the population's either movement or reactions or recovery during the health crisis. But with all that and with all the value that data presents, we've always been thinking on how do we govern this data value in such a manner that we could ensure trust from the beneficiaries of this data innovation and data use, right? Trust from our stakeholders, primarily our partners who are sharing their data. And trust from the users as well in actually believing, right, in that there is a value in the usage of this data. So I will be also sharing my screen to show a few examples of what we've been doing. But the data itself, and as the COVID-19 crisis has been unfolding, you will see that there have been the data itself, especially mobile data, has been used largely all over the world. And one of the key, I would say, or interesting factors in it is that through all this, the trust in data use was one of the key issues, or I would say challenges, in addition to the capacity and the governance framework that would allow for a more smooth data sharing amongst the actors. The maps that you will see are actually represent various initiatives that sort of did the analysis of how efficiently the data has been shared. And the one in the middle is the GSM Association projection of how data has actually, the MNO's data has been used in response to COVID-19. But as I mentioned, right, despite of the various data partnerships and initiatives, there are still multiple gaps in this data ecosystem. And some of them is actually still access to quality data. And the previous speakers have mentioned, right, that brought this issue up, that that actually have the full quality, clean, and representative data set is still an issue. And in many instances, and we're currently also doing work in Africa on developing solutions to ensure access to quality data. And one of the key issues that has come up there as well is that while we may have a very large representative data set, there's still not enough of it altogether in the ecosystem at the, for example, national or specific regional level to be representative enough to ensure that some of the layers of the population or pockets of the population are not excluded from that data set. The technical challenges is actually one of the other key aspects in this, in ensuring access to data, is that when we're still we still do not have proper mechanisms for data access from the technical perspective. There are multiple initiatives that allow us to protect privacy and hence build trust in data as the data exchange happens. However, there is no common, or I would say standard approach on how data could be shared between the stakeholders in an easy and smooth manner. So again, with our work through years, we've been looking at various projects and initiatives to develop such a common approach and common protocol that would allow for data sharing. The legal challenges that I would speak about as well, and that I'm more familiar with than anything else, legal, and I would say the privacy and data protection ones, is the ones that directly relate to the issue of building trust, right, and confidence in that data could be used to deliver good, and not serve as a tool for to pursue malicious results. So legal challenges are various. They vary from contracts, right? As when and the challenge that we encounter in our work is that contracts that are developed on a bilateral basis. But when we're talking about scaling of data to national levels, to regional and global, which is a dream to hopefully come true one day, including in response to the pandemic that we're currently still facing, is that bilateral contracts are not as useful. And there have been some conversations about smart contracts, but again, there are certain challenges that relate to on how these could function in various environments and jurisdictions, right? That also have different types of data protection and data governance systems, under which, let's say, telecommunication sector, financial sector would have to comply with and is governed by. So with various requirements, not only within sectors, but also within different countries and, as I said, different jurisdictions, it is problematic to figure out ways of how data could be shared in a smooth and efficient way. This comes very closely with the political and regulatory changes as well, is when again we think about data, for example, that is locked for the purposes of confidentiality or is locked under a specific purpose governed by the law that is in a way not up to speed to the current needs of the society for data sharing. And we've seen multiple efforts, including by the European Union, for example, that and it's currently these conversations are ongoing to develop the business to government data sharing initiative, which ended up with the recommendations on how to actually create an environment for data sharing, and is currently leading up to a development of actual legislation on data sharing. But again, there is still challenges in how to implement these types of recommendations. So even if we have public education, which is first and foremost recommendation across the sectors, across the jurisdictions that we've encountered, is that first and foremost, those whose data is being shared, and those are also the beneficiaries, right, of the result of this data processing or data innovation. They need to first understand the value of this data use. And I really liked what one of the speakers said, is that we should not be starting with the cool visualizations and data sets. We really need to start with the question, right, and the problem, and make sure that this problem responds to the need of the society, and that the society really understand that this is how this problem can be solved with the data. So we need to really clearly identify the demand. And I think we're still in those stages where many people are afraid or do not have enough trust. Again, I keep coming back to the issue of trust, that data can actually benefit them. And what this results in is in the regulatory frameworks that in a way either prevent data sharing based on consent, and the consent again is not one of the most efficient tools, as we've learned so far, to
Now you have about 5 minutes, less than 5 minutes, right?
Perfect, to allow for data sharing. But consent itself is limiting, and not only limiting, but it's also not as effective in protecting individuals when the data is shared. Similar to how, as I mentioned, contracts would. So as I mentioned, there is a few initiatives that actually have been looking at the challenges as well as provided recommendations on what needs to be done in the data ecosystem to actually enable data use. And the Global Partnership for Sustainable Development, which we also has been working on these issues for quite a while. They also talk about the lack of capacity on both sides, right? Where there is a demand, as well, whereas there is the supply. So the supply coming from private sector in many instances has the right capacity, but the public sector was what we know does not. There is also not enough evidence on how the data could actually be shared in terms of partnerships or successful examples of partnerships. Some of the other issues that were also identified by the GSM Association is actually the sustainable business models, is when we actually need to provide incentives for those who have the right amount of data, who have the right data, who have the capacity, and maybe the legal frameworks or regulatory frameworks can be favorable, but there is really no incentives on how the data would be shared and what is the benefit for sharing it. They're not clearly stated. And that actually one of the topics that was tackled slightly by the EU by the EU as well in their B2G data sharing report. So I would end with a message which Sri Ganesh asked me to share, right? Talking about responsible data. So while we have all of these challenges, one of them that I want to speak to is that we need to think about privacy, and we need to think about mechanisms that actually ensure trust. And the UN actually itself came out with the principles on personal data protection and privacy, which are very common, and I think you would recognize across many jurisdictions as well, national jurisdictions, of speaking about the fair and legitimate processing or purpose specification. And I'm not going to go through each one of them, but the message is pretty clear, is when COVID-19 happened and the UN also came out with the UN joint statement on privacy, one of the key messages there was that we need to act in solidarity and with trust and with respect to human rights. But in addition to all that, we need to understand that there are lives that are at stake. So while we are using data to benefit and to save lives, we need to ensure that it is proportionate to that the risks that we're taking with the use of this data are actually proportionate to the benefit that we're seeking with the use of that data. And I think that's one of the key messages that comes with the use of data in general, is to ensure the necessity of the data use is proportionality as well as fairness, which goes quite along with the overall concept of respecting our fundamental human rights. So with that, I'd like to finish my presentation, and I'm happy to elaborate on it more during the Q&A session. Thank you.
Thank you, Mila, for talking, also introducing a sort of an important facet here that, as we think about leveraging data for better public sector outcomes, we also need to start looking into data beyond what we may already collect from in the public sector and the private sector, and that raises a number of issues that need to be navigated, not just in terms of the regulation, as well as access issues. We'll take some of those up in the Q&A. I know there was sort of someone had raised their hand earlier on the Q&A, Syria Dixon. I would appreciate if you could put that question also in the Q&A box, and if we have, we'll sort of can address it that way. We'll take it up later. But I want to encourage others also to please put in your questions in the Q&A. We already have a few sort of questions coming in. Finally, last but not least, my pleasure to introduce Ibu Devi from the Ministry of Health, the Digital Transformation Office, who will sort of tell us about the things that the Ministry of Health here in Indonesia is doing in this respect. And over to you, Ibu Devi. You have, please keep it under 15 minutes. Thank you.
Okay. Thank you very much, Sri Ganesh. Well, hi, good morning, everyone. It is a pleasure to meet you today. So I would like to share some experience from the perspective of Ministry of Health, Republic of Indonesia, in terms of good practice data in health, especially in time of crisis. We knew that this is some challenges on implementing the health transformations, digital transformation at health sector. There are abundance of data available across multiple platforms with diversity on data formats and types, as well as large volume of the data. The second one, we also have challenges on data quality because currently most of the health data is collected in aggregate format. They are not real-time and sometimes inconsistent. We also have a challenge on user-centric interpretations and lack of digital health informatic talents, especially when we are talking about the fourth most populous country. We knew that the digital literacy and knowledge across provinces might be different from one to another. So one of the goals of digital is, especially on facing the implementations of health big data analytics, to produce actionable insight for decision makers. So we would like to improve the quality of the data, to provide a correct and better information, to have the knowledge and provide wisdom. So we would like to see an evidence-based policy and evidence-based strategy produced in the near future. So when we are talking about COVID-19 pandemic, I believe that crisis might be introducing us into the right time to make a transformation. COVID-19 pandemic has awakened us the importance of health resilience. And we thought that Indonesia health system is ready to transform. But in order to do that, I believe that collaboration is urgently needed towards a healthy Indonesia. So the accelerations of digital transformation has become one of the priority and important at national agenda after the COVID-19 pandemic. So this is some examples of the database COVID-19 pandemic handling policies that have been used having the data. So in order to produce the policy, especially during the COVID-19 pandemic, the government conducts a various database analysis from an integrated technology ecosystem. So we use an integrated COVID-19 big data, let's say for an example, to have the situation assessment that can be a reference for the local government to know how the COVID-19 situations in their area, how the pandemic indicator has evolving. And this data is available for public as well, up to the district and cities level. The second example is about the COVID-19 vaccination data. Using this platform, we know it needs to be done in order to control the situation. So the local government can quickly determine what kind of intervention that need to be taken in order to control COVID-19 in each region. The next one is about having a telemedicine services for self-isolation patient. It consists of two main features. The first one, the telemedicine services will help us on screening process for asymptomatic and symptomatic COVID-19 patients. They will get a free consultation and medications. By having the consultation using the telemedicine, we can divide the patients who need to be referred to the hospitals and the one that can be having just a self-isolation at home. The second feature is when you already have the telemedicine consultation, we also help you help the patients to get the medication delivered to their home. So the patient doesn't need to come to their health facilities. The medication will be bring into their home using these telemedication services. So in here we have around 6,000 of medication package that patient accepted every day, with more than 7,000 patients that access telemedicine every day. In order to do that, we also have collaborations with 17 telemedicine startup. We also have the collaborations with 15 Kimia Pharma pharmacies. This is one of the biggest pharmacies in Indonesia that serve at 17 cities in Java and Bali. We also have a collaborations with a supply chain vendor. This is a private sector that's serving same-day service delivery for 17 cities in Java and Bali. So hopefully using this feature, the COVID-19 patients can have the medications, have the free consultations with the doctor in real time without having to go to the health facilities. The next innovations that also have been developed at the Ministry of Health is Siranap. This is a hospital bed availability information system. Especially during the second wave of COVID-19, many people need to go to the hospital, but they don't know which hospital has a vacant hospital bed. So having this system, the government help the patients. First, they can search the nearest hospital around them. The second one, they can check how many beds are available at the hospitals to treat the COVID-19 patients. It includes the patient who need to be treated in the in the isolation ward or at the ICU as well. So it will help the patients in order to get information in which hospitals the beds are available and they can go there to have the treatment. We also have the patient comorbid data integration. This is a collaboration with BPJS in order to have, and we can check the priority health services that need to be done for elderly and have comorbidities. So we believe that one of the challenges at the number of deaths in Indonesia is because the number of comorbid. Having the comorbid data and we integrate it with the number of people who are confirmed positive, we know who are confirmed positive, they are elderly and they have comorbid, it needs to have a priority of health services. So they can have the treatment quickly and responsively, especially for the elderly who have the comorbid.
Ibu Devi, you have about
yes?
5 minutes,
sure.
Right? Okay, thank you.
Sure. The other feature about Peduli Lindungi is health protocol implementation. When we screen the people who go to the public places, when they go to the station, airport, tourism spot, at offices, at the educations, we collected the number of visits of people who went to the public places, and then we have the stages of those who have been getting full doses vaccination, single doses of vaccination, they haven't got any vaccination, and the last one for the black stages, it indicates the people who are confirmed positive or a close contact of confirmed positive patients, so they could not enter the public facilities. So we screen the people who would like to go to the public facilities using these features. We also have the handling application for the arrival of the travelers, and it has been integrated with the custom and immigration, with the quarantine information system data integration. We also integrate the data with the PCR result with the genome sequencing information system. We also have standardizations of vaccine certificates based on WHO standard. It means that Indonesia's vaccine certificate has already in accordance with a WHO standard and has been recognized in more than 90 countries. So it also can be validated by other countries in other regions. So we learned a lot about how we need to strengthen the coordinations among all stakeholders, especially during the COVID-19 pandemic, how the importance of utilization of digital technology, especially in supporting the database policy. And also we need an acceleration of health transformation across all levels. Considering the previous situations, the Ministry of Health developed a specific unit under the ministry, which we call it the DTO or Digital Transformation Office, that have a mandate to carry out the digital transformation in Indonesia. So by having that one, we would like to have some outcomes, especially on improving the health policy based on an accurate, updated, and completed data. We would like to have an efficient health services at public health center, at clinics, hospital, lab, and dispensary. And the third one is to have the collaborations and digital health ecosystem by involving not only from the government aspect, but also from industry and the public. So in the near future, we will see that Indonesia will have Indonesia Health Services. This is a digital health ecosystem platform that will be developed at the Ministry of Health that integrate a lot of digital health sector in Indonesia, starting with the primary care services, secondary care services, and so on. So I would like to end these presentations by engaging all of you to build digital health ecosystem in Indonesia by not only engaging the government level, but also engaging the private sector, university, medical device industry, community, startup, health service provider, and insurance providers. We need to build up the digital health ecosystem in order to carry out the digital health transformation in Indonesia. So I think that's the last slide for me. Thank you very much, and back to Sri Ganesh.
Thank you, Ibu Devi, for giving us a sense, a taste of the many ongoing activities in Indonesia in the health space. Certainly a difficult challenge given how vast a country that Indonesia has, and it's sort of impressive to see the sort of breadth of applications that are being developed. I also want to make a note, and this is for the participants, the attendees, that the Ministry of Health is open also to collaborations, which is indeed sort of an impressive sign and an acknowledgement of the fact that this is not digital transformation of the health sector is not something that is just limited to one organization, but really involves an ecosystem of many stakeholders and and players. So with that, we are sort of ready to move into the next phase of this, the second last session for today's webinar, which is sort of the moderated panel discussion as well as Q&A session. Because of sort of, we've run a little bit late, we're going to sort of reduce the amount of time maybe to around 20 minutes rather than the 30 minutes. Let me maybe start that off, this session, with a few questions to start this discussion. One of the things that we see, for example, in the in the sort of examples that have been given, right? That we need to both do this in a very responsible manner, digital innovation. But in times of crisis, right, where similar to what COVID-19 was, we often don't have the luxury of time and due process that needs to be sort of ideally followed in an ideal sense. We are working with incomplete data, custom-built, sort of purpose-built, at the spur of the moment, data infrastructure and data pipelines. What are some of the lessons that, maybe this question is first for you, Kasun, based on your sort of your group's experiences with the public sector? How can, the public health sector prepare for these kind of eventualities which will happen in future, so that it's done in a manner that minimizes unintended consequences? Kasun, if you'd like to take that.
Yeah, absolutely. That's a great question. So even though I talked about the best practices of goals and actions and that scoping process, as you mentioned, in time of crisis, you don't have the luxury of time of spending 3 months in scoping a project. However, we do, even implicitly, we do know what problem that we're trying to solve and what metric that we're trying to improve. Maybe it's access to care, maybe it's access to more testing facilities, in a county or a state or a country. So it's important to go through those steps, but maybe a first pass of those steps, right? The project needs to be actionable. So we need, with the data analysis that we do, needs to inform some sort of action. We do know what those actions are. The people who are on the ground know those actions are. And as you mentioned, in times of crisis, you don't have perfect data infrastructure, so you need to cut corners in some way. You might have gaps in your data, but if you have some knowledge about where you want to go, what problem you want to solve, that can inform the gaps that you see in the data, right? So, for instance, if you don't have enough data about a certain demographic people, so people with informal dwellings, people with informal jobs, informal transportation options, recognizing those gaps and being explicit of the shortcuts that you take helps you to evaluate your systems better, right? Let's say you don't have any data about that particular demographic that I mentioned. Then you can actually evaluate your system against them and see how good they are, how good your system is at predicting outcomes for these people. If not, if you don't have any idea, you can use this opportunity as a data collection opportunity as well, right? So if you have opportunity to intervene and help 100 people, maybe select 80 people from that the algorithm suggests you to, that learned from imperfect data, but use the other 20 to explore and see and help people who you don't have an idea about, and that can help you collect data as well. But it's important to have at least some notion of the problem that you're trying to solve and at the goals that you try to achieve, regardless of the crisis situation, because I would argue that that's where you need to be really explicit about the goals, because you don't have time to waste on building things that are not useful.
Thanks, Kasun. And I think I take away that, also this additional point from what you said is that, doing this properly, the experience of doing this properly right now, will help build lessons for when you have to do this, in a crisis situation. So you're better prepared in terms of knowing where you might take, because otherwise you might not be knowing where are the gaps as you sort of in whatever decision that you're making in a time of crisis. I'd sort of ask the same sort of question for you, Mila, as well, from a sort of, because, as we want to use data for improvement of public health, right? Now, Kasun talked a little bit about some of the things that, that could help in that respect to help prepare for when you have to do it in a crisis situation. What might you be able to say in the same topic from a sort of a legal, how can we be better prepared to develop these kind of systems in a time of crisis from a legal and ethics perspective? Go ahead.
Thank you, Sri Ganesh. I think, well, first and foremost, and maybe that's not so much of a legal perspective, but it's more of a larger answer, is that I think we need to start building these systems now, so that when the crisis actually happens, we're able to respond. And one of the pending issues was that, an ongoing access or stream of data, constant stream of data, and the frameworks around the use, access, and the use and further use of this data need to be actually prepared and done in advance. So in merely what I'm saying is we need to have legislative frameworks, and I mean it, legislative frameworks, because those that currently exist, well, at least globally and not everywhere, nationally, they allow for a fast example of change of purpose. So we might be collecting data such as mobile telecom data, CDRs, call detail records, right, for billing purposes. And I'm talking about the telecom operators collecting this data for billing purposes. But in many instances, legislation would prevent sharing this type of information for, in responding to COVID-19 crisis, or to simply understand, spending patterns, in recovery in the aftermath of the crisis. So these types of circumstances, need to be looked at in advance, and we need to make sure that. And I'm not talking about because having the technical infrastructure is one issue on its own. You asked me about the frameworks and the policy aspect, right? So my answer to that would be specifically limited to the legal frameworks, is that the laws need to be updated into such an extent where they have a venue or exceptions, flexible exceptions when a crisis happens, so that the data could be instantly shared and repurposed and accessed in a timely fashion. And that hasn't been done yet. I think COVID-19 has actually prompted this type of response across the world. And in many circumstances, the data was simply accessed or shared, but there were no provisions in law that would actually justify that. And I think while the public saw the value of using this data and sharing of this data, but I think a lot of the public also kind of had a mistrust of how this was handled. So I think definitely from the legal perspective, a regulatory perspective, we need more awareness to the public on how this data can be shared in a legitimate way, right, to benefit the public. And also we need to act with the legislation itself clearly on data access and sharing. And just quickly on the, what we have been doing in generally, like if we are, as the UN and as we've been working in many areas or jurisdictions that don't have clear frameworks for data sharing and repurposing of data, what actually has been, what been raised is that in the absence of framework, what do you do, right? Do you actually not access the data and you simply forget about using it for the public benefit? Well, I definitely want to say that the answer should not be no. The answer should always be yes, with proper mitigation measures. And the way we've been looking at it is from the, from the risks, harms, and benefits balancing test that we've been applying in many instances, even when the data is not directly identifiable, or even when it's just aggregated community level data. Again, the message is, I think we always need to balance the risks, harms, the likelihood of the risks, the likelihood of the harms, their severity and the magnitude in comparison to the benefit that we're trying to achieve. And specifically, this is more relevant not more relevant, but specifically, this is very relevant in those circumstances when we don't have proper legislation to cover these circumstances.
Thanks, Mila. And, there are questions coming, and maybe sort of take some of those two and maybe combine some about, the want to, we obviously want to reduce misuse of data, but we also don't want to have misuse. So even when there's, the legislation, etc., is not necessarily in place, which is true for a lot of countries. Maybe, Ibu Devi, you could sort of maybe talk a little bit about how the Ministry of Health here is approaching to ensure that there's sort of responsible use of of the data that is being collected and used, as well as around the security. That was a question that came in from the floor, from the virtual floor. Ibu Devi?
Yes, thanks, Ganesh. So regarding the data security, let's say for the individual data level that has been collected, we also have already taken into consideration some preventive measures, such as with the internal and external processes. By the internal, by having the sufficient and distinguished technology team to help us in order to secure the data security of the system. For the external purposes, we also have already engaged the BSSN, or the National Cyber and Crypto Agency, which has the functions on ensuring the data security at every level at the ministries, as well as with the Kementerian Kominfo, the Ministry of Communication and Informatics Technology in Indonesia. So by having those measures taken also into considerations, we would like to have some preventive measure within the internal, as well as the support from the external as well, to ensure and having a routine check on the data security as well. That's what we have done, Sri Ganesh.
Thank you, Ibu Devi. And I think, to take from your answer, the fact that, one is involving sort of security experts in the work that y'all are doing. The second sort of takeaway for me from your question is the point of doing those frequent checks and doing those sort of audits on the system, because risks will come from many other places. These, I suppose, are some of the sort of mitigation measures that need to be taken when sort of maybe all the laws and regulations are not necessarily in place, and doing this sort of risks, harms, and benefits exercise on a sort of a frequent basis of whatever is being developed. I'd like to sort of switch gears for a bit, and then we can come back to some of these questions. And I wanted to ask you, Vincent, you talked about one particular example, which is sort of agent-based models, right? And one of the sort of recurring theme here has been, how do we sort of ensure sort of you have good data collection? We've seen the measures that the Ministry of Health is going towards. Kasun talked about, we need to have goals very clearly defined. And, I think in terms of, let's taking just the example of COVID-19 and especially the early stages, but, it's applicable for any such new pandemic where there isn't sufficient data, nor there is sufficient knowledge about the disease, right? And you're trying to understand and make policy on the fly with limited data. So how do you, when you sort of, in agent-based models can help you evaluate different scenarios, but, that old adage, garbage in, garbage out, right? So how do you sort of try and validate, verify if some of even the existing knowledge or assumptions that one is making about the disease is actually in fact correct, and whether agent-based models can be helpful in that respect? Over to you, Vincent.
Thanks. Yeah, that's a very important question, I guess. There's a number of layers to that. One is actually, and that comes back to the earlier discussion, it's actually about the communication of the results as well. So what I mean by that is, when the policymakers want an answer, very often they're after a specific number. They want a clear answer, and that we cannot provide. And it's true whether we've got enough data, whether or not we've got enough data. So it's even truer when there's lots of uncertainty. And so the two-way communication has to be adjusted. So the decision maker need to understand the limitations behind the models, and they need to accept that we are talking about likelihood and we are talking about risks. What are the risks of one option versus another? And that is especially true when there's very little data available. So we can provide a likelihood of something happening, we can provide a risk of something happening, but there's always going to be a certain amount of uncertainty. So that's one element, the two-way communication. So I guess on the decision maker side of things, they need to understand what the model can provide, and the modelers need also to understand that the way the science is being communicated is also important from a policy-making perspective. Now, when there's very little data available, one thing, and there's assumptions being made, one thing that can be done is sensitivity analysis on the parameters. So let me take an example. Say, for example, there were lots of questions early in the pandemic whether social restrictions would be effective. For example, wearing masks. I remember in Melbourne, one day an expert will come and say, wearing masks is essentially useless, and then the next day it would become mandatory. And so there was a general perception, at least in the general audience, where we don't know what to believe, what to trust, etc. With a model, what you can do is you can do a sensitivity analysis. And so, for example, if you've got this parameter in your model, and you can vary this parameter and see how this will influence the outcome. And so, for example, the model might tell you that, in fact, this parameter is not at all important, and whether or not you wear a mask is not going to change anything. In the case of the mask wearing exercise, that wouldn't be the outcome, but I'm just taking that as an example. So by carrying out a sensitivity analysis on the parameters, you can essentially alleviate some of this uncertainty around the lack of data by determining which factors are likely to be important in the response.
Thanks, Vincent. It's sort of, it again goes to reinforce the way that you build an innovation and you don't sit back. That's a sort of iterative process, especially in the times of crisis, to make sure that we're getting it right, and that feedback mechanism that helps to sort of improve the overall innovation itself. One thing that Kasun had mentioned earlier around, when talking about in crisis situations, and he mentioned this example of, some of your vulnerable populations you might miss, right? If we take even, for example, the Peduli Lindungi app, right? The basic precondition is the fact that everyone has to have a mobile phone, right? So how do you cater to people who don't have a mobile phone? But my question to sort of Ibu Devi, building off a question that has come in from the flow is, especially in the case of COVID-19, we've seen that, vulnerable groups are that much more affected, and vulnerable, even in a sort of gender dimensions are important, right? So what is, maybe you could speak to what the Digital Transformation Office is doing, that data is properly inclusive to capture beyond just gender that was mentioned here, but also like people with disabilities or other vulnerable groups. If there's anything you could speak to that. Over to you, Ibu Devi.
Okay, thanks very much for the question, Mr. Ganesh. I believe that the health services need to be accessed inclusive for all people in Indonesia, not seeing about the gender, the race, the locations, as well as you mentioned about the vulnerable of the populations. And that's why by having the digital transformation technology, we prepare some layer of digital technology access. Let's say for the first one, for the people who might have a very good digital literacy, they could access the information using a mobile applications. But we also provide the second layer of technology, which is using WhatsApp, because WhatsApp kind of the second layer. People might be not knowing about using mobile applications, but they are more familiar with WhatsApp. Even that's what we are doing at Posyandu. Posyandu in Indonesia is one of the biggest movement in the community to measuring the height and weight of the baby. And I believe, let's say 80% or 90% of the Posyandu cadre, they are more familiar with WhatsApp rather than the mobile application. And that's why we also provide the second layer of technology in order to ensure that everyone can get access to their health information and health services. So the other things that also need to be taken into consideration when we are developing the technology as well is about considering the access to the electricity. Let's say at some places in Indonesia, let's say in the eastern part of Indonesia, first one, they might not have an internet coverage across all of the area. So what we also need to consider when building a mobile application, they can input the data in offline mode first, and then can be synchronized when they have access to the internet. The second one is about, let's say, the electricity access. Even at some places, they also have a problem with electricity access that might be not every day they can, not every hour they can access the electricity. So we also need to adjust the technology, let's say, for they input the data into the computer for a registration process at the public health center. We also need to consider those kind of circumstances to ensure that in every condition, in every taken into consideration many factors that might be affecting the health services that can be delivered to the community as well. So that's one of the anticipation that we also have already taken into consideration when developing the concept of the digital health transformation in Indonesia.
Thank you, Ibu Devi, and also for often there's a sometimes an expectation that when you're doing digital transformation, everything will be solved by digital, and often the other elements, that the analog components that are important, like for example electricity access, having the ability to engage in an as well, to enjoy inclusivity. All of these facets are important for the larger digital transformation agenda, which is maybe part of it is not digital, right? I also staying with you, there's another question that is from the floor around, what, Indonesia is a complex, large country, spanning 3 time zones, more than 17,000 islands. So it's a sort of difficult territory in some respects to sort of bring about digital transformation, right? And one of the questions here is, what is your sort of strategy in expediting and integrating these sort of diverse distributed systems, right, in as part of the digital transformation agenda? Whether it could be sort of you're thinking centralized, or is it sort of a federated system, right? Maybe you could share some brief comments on that as well. To how do you ensure that this happens in a timely manner? Thank you.
Okay, so the first one, the integration system, some of them come up at the, let's say, at the central level. So let's say not only across the Indonesian, across all provinces in Indonesia, but also across, let's say, ministries first. When we are talking about the data from the custom and immigration, the data from the transportations hub and so on, it means that we also need to integrate the data from them, and I would like to admit that it quite takes some time, but the pandemic really taught us a very good lesson learned, that by joining our hands together and have a very strong collaborations and coordinations, and we can provide them the clear results by having this integration, what you would like to get as well. So they knew the benefit when they would like to share the data with us. And we also taken into considerations about the data security and so on. So we built up the system together and provide the quick win results to them. So they also can see the benefit of having the integrated system. The second one is about the challenges across the Indonesian provinces, islands, and so on. That's what I have already mentioned, that we need to have several layers of technology that need to be implemented based on the local situation that might be different one from another. So the digital transformation, it also to take into consideration that what you said might be not all of them are digital, might be some are still semi-digital, some at some places might be still in manual processes, but at another processes it will be taken into the digital process as well. So that's what we are currently doing, and having a strong collaboration as well with the local head of the government, local government, because the centralization system also required us to have a strong coordinations and collaborations with the local and the head of the local government. So we will have the similar objective, and we would like to go together with the same methodology, and it can be expanded across the district and cities in Indonesia.
Okay, thank you. One last question, and that's building off another question from the floor around how do we sort of make sure that there are sufficient incentives for providing accurate data, right? Mila talked earlier around, how trust is an important component of all these things that we build, not just in the system, but the sort of policies and laws around it. And trust is a two-way street, right? So linking the sort of trust angle into this question, maybe I'll leave this question open to any of the panelists who may want to chime in. How do we ensure that we ensure that it's sort of, incentivizing people to report the right set of data, as well as ensuring that you're providing trust in that the system is being used as it's supposed to be used without unintended consequences. That's sort of, I'll leave it as an open question for the panelists, anyone who wants to chime in, and then we'll wrap after that. Mila, yes, go ahead.
I'll quickly say, and not emphasize the governance frameworks, but the other aspect is actually, I mentioned earlier, capacity building is one. So basically engaging, involving, and as well as investing in building digital literacy and people's understanding of data value. And that's how you get trust, I think, by explaining what the risks are, but also explaining how these risks are managed. And then the other aspect of this advocacy or awareness building is also the lost value if the data is not being used. How will this affect your community? How will this affect your child in your household if the data that you have is not used? This is what you're this is what in reality you will lose. And I think that's kind of showing the risks of not sharing the data is like is something that hasn't been really approached or done in the past, and might, I think, help. And then this and so in addition to capacity, I would say it's awareness combined, of course, with all the policy and governance and technical building around that.
Thank you, Mila. And maybe I'll leave that question for the others, and you can use it also as a way as for any concluding comments before we wrap up. Who wants to go first? Kasun?
Yeah, I can go. Thanks very much. Yeah, I completely agree with Mila as well. And just to add to that, data gaps, incentives to share data, all of those don't live independently of a problem and a decision that we're trying to make. The same predictive model can be used for making different types of decisions, right? Epidemiology model of tracking cases can be used to either deploy more testing centers or enforce lockdowns on a separate area and close businesses down. And those two applications or decisions have very different implications of what the people get out of sharing their data. And that communicating that very effectively and very clearly to the people on how their data would be used, not to just, okay, your data would be used to predict this and this. No, your data would be used to predict this and this to make this particular decision that is made by this particular human. That collaborative decision-making system that is often done in the public sector between a human and a machine and then communicating that effectively to the public when we're actually using the data is very important, I feel. Yeah.
Thank you, Kasun. Maybe Dr. Vincent first, and then Ibu Devi, you'll have the sort of last word. Vincent, any sort of concluding, you want to take that question as well as any concluding comments?
Yes, thank you. So expanding the issue of trust to models, I think, one of the questions that keep coming back for very good reasons is how do you validate the model? How do you make sure that the models are you can have trust in the model? And I think what we need to realize is, so COVID-19 in a sense has given us an enormous chance of creating an enormous amount of data, and we need to learn from this experience. And so I think, unfortunately, there's a tendency, and I think it's just a human tendency of moving from one crisis to another. And as soon as things go quiet, you just move on and do something else. I think now is actually the time to build trust, because now we can essentially use all of this data that is now available, learn from our experience, develop the processes to essentially build the next generation of models, so that we build trust in the models before they can actually get used for the next crisis, as opposed to waiting for the next crisis to happen and then develop everything in a rush. And I think we very much need to learn from our mistakes, learn from experience. And I do hope that we won't see a situation where, especially in research, funding moves from one crisis to another. And in several years' time, 5 years from now, etc., we'll end up in exactly the same situation, and we'll have to build new models again. And this issue of trust will remain.
Thank you, Vincent. And Ibu Devi, the final word is yours.
Okay. So I think the pandemic has brought us the accelerations of digital health transformations, especially in Indonesia. But we believe that we still have a lot of homework to be done and a lot of challenge to overcome in order to improve the health access and the health services across Indonesia. I would like to engage everyone in this room, the collaborations with you all to take part into the digital health transformation that are currently going on, as well as to build up the digital health ecosystem in Indonesia as well, to improve the health Indonesia in the near future. That's from me, Sri Ganesh. Thank you very much.
Thank you, Ibu Devi, and thank you to all the panelists for sort of your presentations and your sort of thoughts and and expertise that you've shared with us today. I know we don't have enough time to sort of go into sort of all the questions that have come in or in sort of the detail, but a few sort of key takeaways. I'm sure there are more. One being that, it's not just about the digital part, but, that in order to ensure that, we're inclusive, we need to think about the other related facets of and responsible use. We need to think about also sort of offline mechanisms, as well as, ensuring that the vulnerable populations are not left behind. Second, about the point that, data partnerships, etc., these systems need to be built before the pandemic or the next crisis, and the importance of sort of investing in this. And indeed, in that respect, what has been happening here in Indonesia is certainly timely with this digital transformation agenda. And finally, before I hand off, let me also reiterate Ibu Devi's point that they are open to partnerships and collaborations as well. Thank you once again. Sorry we ran in a little bit over time, but hopefully everyone found this a useful presentation and discussion. Thank you, and over to you, Desi.
Thank you so much, Ganesh, and thank you for all the speakers for your time and sharing all the information with us today. Before the speakers leaving the meeting, I would like to take a picture first of all the speakers and the moderators. So with the help with the Pulse Lab Jakarta team. So I'll ask all the speakers to give the best smile and then the best freestyles if you would like. So we're gonna take a picture in 3, 2, 1. Okay. Thank you. Thank you again for all the information and the insights that you have shared with us today. That's almost conclude of today's session. Before we conclude the session, I would like to invite Pak Petra Kakareci, the head of Pulse Lab Jakarta, to deliver some closing remarks. Pak Petra, the screen is yours.
Thank you, Desi. So I think Sri Ganesh, you very effectively summarized all of the main points, so I won't go over those, but just a huge thanks to our speakers, Mila and Kasun. I understand it must be quite late for you now, and just our huge appreciation for you staying up and sharing your insights, which were excellent. And also, Vincent, I know how busy you are as well. So thank you, Vincent, for also the collaboration with Pulse Lab Jakarta and the whole CSIRO Data 61 team in supporting the work here. Bu Dewi, the breadth of your work and what's going on with the Ministry of Health under this digital transformation is so impressive. It's so important. And I think also has a lot of lessons to be shared globally. So we so much appreciate this opportunity, and we hope for further opportunities with you to be able to learn about what's progressing also in Indonesia. I think just in also a huge thanks to the team that's put together the event, Sri Ganesh for moderating this very effectively, by Irfan and Parudi for the collaboration with the Ministries of National Development Planning and Ministry of Health. It's been an ongoing pleasure to work with you. And also, I have to say our sincere appreciation to the government of Australia and the people of Australia for the financial support that's made this possible for Pulse Lab Jakarta to continue operating as it is. I think just one last final thought, the importance of partnerships, as everybody has emphasized. And also, with all of this excitement around digital transformations and the potential of the data science, et cetera, before we really progress things, it's not just about can we do it, but should we do it as well? So just leave you with that, and wish everybody a wonderful day. Stay safe, stay healthy, and look forward to seeing you all in further events in the future. Thank you.
Thank you so much, Pak Petra. That brings us to the conclusion of today's session. I would like again to thank Ibu Dewi, Mila, Vincent, and Kasun for your invaluable insights, and Sri Ganesh for moderating, and also the team from the Ministry of Health, Ministry of Development Planning, Pulse Lab Jakarta for all the collaboration in making this event happen. Finally, thank you, our guests, for your participation and excitement. We hope this discussion can be insightful for all of us and in responsibly utilizing and innovating with data for better policy response in the time of crisis. My name is Desi, and on behalf of Pulse Lab Jakarta, we thank you once again. Stay safe, stay healthy, and connected. Bye, everyone.
Bye.